Today we are going to start with a new chapter, and this is the chapter of health and diseases. Now, health and diseases directly hasn't been mentioned anywhere in your syllabus, neither in your prelims syllabus nor your mains syllabus, but we have seen that once in a while questions do come from here at both your prelims level as well as your mains level. So that's why this is one chapter which cannot be neglected. At the same time, it is also important for you to know what kind of questions have come in the past. For example, if you look at the 2021 question paper of your prelims examination, you will see that a lot of questions related to COVID have come. There are at least 3 to 4 questions which are directly or indirectly related to COVID-19 situation and the pandemic. At the same time, if you go back into the history, you will see that questions have come in the past related to the diseases that were in news. For example, 2019, your prelims examination, a question had come on Zika virus. Now, why Zika virus? Again, the reason being this, that in April 2019, for the first time we saw a Zika virus case in India, that was in Ahmedabad. 2 months later, June 2019, a question in the prelims examination has come on Zika virus. So that's why you will see that the kinds of questions that have been picked, there is a pattern here that questions have come from areas related to current affairs. So that's why the diseases that are in news will remain important for you. But it does not mean that the diseases which are not in news currently, questions will not come from there. It doesn't say anything like that. For example, if you take the case of polio. Now polio, we know that for a very long time, we haven't seen, almost more than 10 years now, we haven't seen any case of polio in India. But polio remains an important topic for you, mainly because this also speaks about the win that India has achieved against a disease. So that's why these kind of diseases will always remain important. Plus, there are some diseases which are common in India. So these kind of diseases will always remain important. Now, one word of caution, that you should not go behind each and every disease. You should not keep learning about each and every disease that you have ever come across. You don't need to do that, because there are thousands of diseases and it's not possible for you to know about each one of them. So that's why we'll be focusing on the diseases which are common in India, which are a menace for India or have been a menace for India. So those are the kinds of diseases that will become more important for us. And then after that, we'll move on to some other areas related to diseases as well. For example, we'll discuss about nutrition, we'll discuss about drug resistance, we'll discuss about Ayush and all these kind of topics as well. So to begin with, the very first thing that we need to understand is the meaning of the word disease. That when I say disease, what is the meaning of the word? So malfunctioning process interfering with normal process of the body. That is, any malfunctioning which is not letting body behave normally or function normally will be called as a disease. Now in general, there are two types of diseases. One which is called as a congenital disease and the other one which is called as an acquired disease. What is the meaning of congenital disease? Congenital disease is any disease that is present in an individual since birth. So if there is something, for example, a very common case of a congenital disease is somebody having a hole in their heart. Now, hole in their heart is not something which is not treatable. There are operations that happen very easily, and many a times people do not even know that they have a hole in the heart unless they go through a physical exercise or a very intensive physical exercise. Then only perhaps they would come to know. Otherwise, they do not even come to know that they have this kind of an issue. Health checkups, etc. will reveal sometimes that they had this kind of an issue. So congenital disease is any disease which is present in an individual since birth. Then in that case, you call it as a congenital disease. Then after that, you have acquired disease. What is the meaning of acquired disease? The name itself suggests you that if something has been acquired, it could be through a pathogen, it could be because of your lifestyle changes, it could be through XYZ factors. But it was not present in your body since your birth. You acquired it after birth via one reason or the other. That's why it will be called as acquired disease. So in general, the diseases can be classified as a congenital disease or an acquired disease. Now when we talk about acquired diseases can be classified mainly on the basis of two. One which is called as a communicable disease, and then you can talk about non-communicable diseases. So what is the meaning of a communicable disease? Any disease that can be spread from an infected person to a healthy person can be called as a communicable disease. And in most of the cases, you will have a pathogen behind it. You will have a pathogen behind it. What is the meaning of pathogen? The carrier of the disease or the causative agent of the disease will be called as its pathogen. The second kind of disease could be non-communicable disease. So what is the meaning of non-communicable? The kinds of disease that you will not get from a diseased person. So for example, diabetes. In case of diabetes, if there is one person who is diabetic, it does not mean that everyone in the vicinity will also catch diabetes from them. It will never happen. But let's say common cold or tuberculosis or chicken pox. These are the kinds of diseases which can spread from one person to another or can spread in general via a causative agent, which is a pathogen, called as a pathogen. So that's why there are two kinds of acquired diseases. Either you have communicable or you have non-communicable diseases. Now, if you start with the first one, the first bracket, that is communicable diseases, also called as infectious diseases. Now, this is something that you should remember. Maybe questions will not come from here, but you should remember this, that when you talk about this particular term, infection, always remember that infection can only be associated with a communicable disease. Alright? So infection is a term that you should not use with a non-communicable disease. That for example, if I say that one person has been infected with chickenpox or has been infected with COVID-19, then in that case that's a correct statement to make. But if I say that this person has been infected with heart disease or has been infected with diabetes, that's wrong. Alright? So infection is a term, scientifically speaking, infection is a term that should only be used in cases of communicable diseases. It should not be used with a non-communicable disease. So just remember this, because what happens is that we have a common way of saying things and we probably will mix up the terms and use it. But if you are speaking scientifically, then saying that somebody has been infected with a non-communicable disease is wrong. Alright? So when we talk about this kind of a disease, which is called as a communicable disease, it can spread from one diseased person to another through contaminated food, water, even insecticides, animals, or any kind of carrier. So that's why it is caused by different kinds of causative agents. As I told you, they are called as pathogens. They are named as pathogens. So examples: hepatitis A, measles, HIV. I discussed about other examples as well. For example, COVID-19 is an example, chickenpox is an example, rabies is an example. There are many such examples. So all these are communicable diseases. Why? Because they can be spread from somebody who is infected to somebody who is not infected. So when we talk about the communicable diseases, there are two ways in which they can be transmitted. Either there can be a direct transmission or there can be an indirect transmission. So what is the meaning of direct transmission and what is the meaning of indirect transmission? So first, if we talk about direct transmission is something that can be spread from the infected person to the healthy person. Alright, directly. So directly means what? There can be n number of ways in which direct transmission can happen. And for example, you are in direct contact. Alright, you are in direct contact with the person, you can get the disease. Then there can be droplet infection. Another way in which direct transmission can happen is droplet infection. What is the meaning of droplet infection? That small particles of mucus would have spread in the air. So for example, let's say when you cough or when you sneeze. So while coughing or sneezing, droplets from your mouth or nose will get suspended in the air, and anyone else who is breathing in the same air will get that droplet. And this droplet has tiny particles of the disease or the pathogen. Whether the bacteria, virus or anything, it has those pathogens, it has those organisms, and whoever is breathing in the same air will also get these pathogens in their system, and inside their system these pathogens will start to multiply, and thus the infection would have spread from an infected person to a healthy person. So there are multiple ways in which direct transmission can happen. First is direct contact between an infected and a healthy person. So for example, smallpox, chickenpox, syphilis, gonorrhea, all these are examples which can happen directly with contact between a healthy person and an infected person. Then after that you have droplet infection, as I discussed, that through droplets of mucus by coughing, sneezing, etc. So COVID-19, common cold, pneumonia, influenza, measles, tuberculosis, whooping cough, all these are examples of droplet infection. So that's another way in which a direct transmission can happen. Then after that, direct transmission can also happen through soil, and this is especially prevalent in small children. Children who go outside and play, especially during the rainy season, if they are in contact with the soil, there are chances that they can get a disease from there. So that will be called as another way of direct transmission. Then after that, animal bite. Very direct, simple example is rabies. That in case of rabies, what happens? That there is a rabid animal, it could be a rabid street dog. That dog bites a person. With the biting of that dog, what happens is that the virus that was there in the body of the dog, in the saliva of the dog, now has entered the body of this particular person. So that's why this is also a direct transmission, because the transmission of the disease directly happening from the animal to the human. So that's why this is also a case of a direct transmission. So virus of rabies are introduced through wounds caused by the bite of rabid animals, especially dogs. Virus is present in the saliva of the rabid animals. So that's why this is also a direct transmission, because directly the transmission is happening between the animal and the human. Now after that, there are indirect transmission ways. So when you talk about indirect transmission, first it can be vector borne. What is the meaning of vector borne? The meaning of vector is any carrier. Like for example, you can have house flies, mosquitoes, cockroaches, all these can be carriers of the disease. Now what's the difference here? We discussed that animals can also give you the disease, and here we are saying that these carriers like mosquitoes etc. can also give you the disease. Then why is animal bite a direct transmission and a vector borne disease an indirect transmission? What's the basic difference between the two? The difference is simple, that when you talk about an animal bite, or let's say rabies, then in case of rabies, what is happening is that this dog that would have bitten a person, this dog already had the disease. The dog was also infected with the disease. Alright. But in case of a vector borne disease, what's happening is that the mosquito, for example, let's say if you take malaria. Now in case of malaria, the mosquito already did not have malaria. Alright. It was just carrying the protozoa that can cause malaria. So the mosquito is not infected. Alright. Mosquito is not infected. Whereas in case of rabies, the animal was infected. So that's the basic difference. So that's why we are saying that animal bite is a direct transmission and vector borne diseases are indirect transmission. Because in animal bites case, the animal was already having that disease, was already infected with that disease. But in case of a vector borne disease, what we know is that these mosquitoes or houseflies or cockroaches, they are just carrying the pathogen. They are just carrying the virus or the bacteria or the protozoa or whatever, but they are not infected themselves. So that's the basic difference between why we are saying that animal bite is a direct transmission and vector-borne diseases are indirect transmission. Then after that, it can be airborne, that pathogens may reach humans with air and dust, that let's say the cysts of these pathogens are suspended in the air, and when you are breathing in that air, you are inhaling it, and then you can get the disease from there. So here we are not saying that the droplets from another person were suspended in the air. We are just saying that cysts of this disease or the pathogen would have been suspended in the air. So that's the basic difference here. Now another way in which indirect transmission can happen is it can be object borne or fomite borne. Meaning what? That the pathogen would be present in some of the surfaces. For example, it could be on a doorknob, it could be sitting on a plate or a utensil that you are using. So it could be anywhere on all these things. So if it is spreading from there, then in that case we'll say that it is object borne or fomite borne. So transmission through the use of contaminated articles such as clothes, utensils, door handles, syringes, surgical instruments, etc. will be called as object borne or fomite borne. So one classic example is hepatitis B, and we'll have a discussion on hepatitis B and why I'm saying that it could be fomite borne. Then diseases can be waterborne. Waterborne meaning that they are in contaminated water, like for example cholera. Cholera is an example of such a disease. So consumption of potable water contaminated with pathogens like cholera, diarrhea, hepatitis, jaundice, etc. Alright, so these are some of the ways in which indirect transmission of the disease can happen.